capable of giving a more detailed answer than I can on that.
Thank you, Chief Minister. Yes, there are a lot of issues about population screening for COVID, and in particular the use of the lateral flow devices for that purpose. The lateral flow devices seem to be very good at picking up people with high levels of virus, which is good, but they also do miss a significant number of people who are infected, either because the test is badly done and doesn't find the virus that was there, or the test is done okay, but the person was still incubating and may have had a test that did not read positive at the time, but go on to be infectious the next day. So there are all manner of issues around this testing modality and how you interpret it. In terms of using it for mass population screening, this is completely experimental. There is no data or evidence to indicate how well it works, what the pluses and minuses from it might be. One of the major problems that one can anticipate from it is when you start trying to use it as a screening test in a population which is actually experiencing very low levels of COVID infection, then the risk of picking up false positives actually becomes a bigger risk than the risk of missing positives. And that's because the pre-test probability that anyone, particularly someone with no symptoms whatsoever, as in the screening context, is actually going to be positive for COVID is very, very low. So the risk then, as I say, becomes that you pick up more false positives. You then have to think about what the implications of that are, both for the person and their family and the wider economy. And if what you're saying to them is, if your LFD is positive, you must go home and you and your household must isolate, and you must contact 111 in our case and get a PCR to confirm whether or not that LFD was accurate or not, then you're actually putting a lot of burden on those individuals and potentially the economy for having taken them out of the economy. You then create another layer of issue, because when they have the PCR, the question is, how do you interpret that PCR result? If the PCR is positive, do you then require them to self-isolate? If it's negative, do you accept that it was negative, or do you say maybe we should retest this? We actually don't know, because these studies have never ever been done. So this is actually quite a fraught area. And as the people who provide the sort of behavioural insights to the UK government on this, as they've pointed out, actually people will be quite likely to vote with their feet and not actually come forward for testing. There was a study published, I think, over the weekend or just at the end of last week that indicates that even people who are symptomatic with COVID symptoms, only about 1 in 4 of them actually come forward for testing in the UK. And the reasons for that are going to be many-fold, but probably a fairly key one is that these are people who are really concerned about having to take time out of work, lose income, the impact on their whole household if they all have to isolate. And so actually they take a call that it's better not to go and be tested. So if we're talking there about people who already have symptoms, the uptake for people with no symptoms, bearing in mind the burden on them if they get a positive LFD result, really does have to call into question whether it's going to be useful to try and do that. And the answer is, as of now, we just don't know, because it's never been trialled, never been piloted, and it's all a big experiment, really.
There you go. Director of Public Health, Isle of Man, Dr. Henrietta Ewart, admits it's all just a big experiment. They don't know what they're doing. The PCR tests, they can't rely on. Make your own minds up, guys. There it is for you.